Thank you very much for the organizer of this conference, and also thank you for all colleagues around the world, especially my colleagues from India and all other South Asian countries, doctors. And I'm glad to be here and discuss cancer problem for women in Afghanistan, because we face this is a big problem for Afghanistan. Let's start, and I will share my experience, what we did for Afghan women, especially in these situations. You better know that we are facing a lot of difficulties. Yeah, I'm talking from Afghanistan Cancer Foundations that work for cancer patients, especially for women in Afghanistan. Uh, uh, Women cancer in Afghanistan, it's a serious issue for all worlds, but especially for Afghans, because we don't have any facilities inside of the Afghanistan. So according to WHO research, that it shows that about 20,000 people diagnosed with cancer in 2014, and almost 15,000 people dies from cancer. What we did, Afghanistan Cancer Foundation did a questionnaire survey at school, university, and public areas. It shows that these surveys include half male or half females, and it shows that high risk are and for women, it's breast cancer, which shows that it's about 33% amount all cancer. Here, as you can see, WHO, International Atomic Energy, Afghanistan Cancer Foundation, and National Cancer Control Programs that we collect this data and analyze it. You see here is WHO breast cancer, IARC breast cancer, Afghanistan Cancer Foundation says breast cancer, and CCP says breast cancer. So breast cancer is the top of the cancer in Afghanistan. Then second, stomach, cervical cancer, and another cancer. Here you can say that comparisons of rate and SR and incidence of cancer for female. You see in the world, Germany, UK, Australia, South Africa, Afghanistan. Afghanistan is in low stage, but still, because we don't have exact data, maybe this is another problem. Here you can see estimated rate and ASR incidence for females. You can see breast cancer is at the top. Here you can see that the incidence of breast cancer. Again, you can see here as you compare, Afghanistan is also in the middle. Here you can also say that date of cancer due to cancer, especially for women, is breast cancer. It is a very high than other cancers. What we have the challenge, because we have lack of professional oncologists. We don't have an oncologist, unfortunately. Lack of medical advanced equipment and centers, and also public awareness. People don't have public awareness regarding how to control themselves to not affected by cancer, or no exact cancer data. I'm happy that we have cancer registry that the Tata Memorial Hospital, I think from Mumbai, they help us. We install this in NCCP in Jamhuriyat Hospital, but still we don't have trained medical staff. That's another challenge for us. Here is the recommendation. What can the South Asian countries, or especially our neighboring country, can do? Afghan needs special attention from SAARC countries, because nowadays we don't have a lot of problem, because we don't have professional people inside to treat a cancer patient, and we don't have any possibility to enter to other countries, especially Pakistan now can work well for us, because other flights are closed. So now I think president of the SAARC Federation of Oncologists can help us about this issue. As the second one, as Afghanistan is a member of SOFO, So we need high support and assistance, especially from our oncologist colleagues, that they help us about this. Second, encouragement from our SOFO colleagues to take part in the promotion of cancer centers in Afghanistan, because we are trying to build a cancer center in Kabul. So we need support from our colleagues. SOFO members could cooperate with their countries, especially for the easy entry permission for the treatment of cancer patients, because we ask all colleagues that they talk with their government, those patients that we are referring for the visa or for entry. So please don't, if it is possible, to give them a easy permissions or process of visa that they can go there for treatment, because they have resources, but they unfortunately they don't have way to go there, send for treatment. And we also respectfully request all our respected South Asian experienced oncologists to take part in Afghanistan diaspora, because we are going to make a special program for Afghan doctors to share the experience with them, and to also for the promotion of cancer control program. If everyone from SARC Federation of Oncologists or other colleagues from different hospitals, India can work well, Bangladesh, Sri Lanka, and other colleagues, Pakistan can also, colleagues can help us in this program. If you agree, then we can discuss about this in the futures. Training for medical staff for cancer registry, that we also train some people from Tata Memorial Hospital, I think, if I don't do mistake. Then we ask them to, if it is possible, to train these people to collect the exact data, because now we collecting this data, it's not exact data, missing a lot. So these are our recommendation, if possible, to help us in this issue. As I mentioned, that we facing a lot of problems recently. So I respectfully requesting all colleagues, even if you can help us a little, it will be a huge support for Afghan cancer patient or for all doctors. Thank you for your time, and have a nice time.